Which of the following histopathological findings would be most likely? Cortex scarring and deformation of the renal calyces, interstitial fibrosis and tubular atrophy, glomerular basement membrane thickening, subendothelial immune complex deposition, and crescent formation in glomeruli. This is a 40-year-old woman with a history of recurrent urinary tract infections, presenting with fever, chills, and flank pain. She also reports dysuria and increased urinary frequency. It reveals physical exam reveals costovertebral angle tenderness, and the urinalysis shows pyuria, hematuria, and bacteriuria. This is looks like pyelonephritis. Specifically, I think we've extended enough to the kidney with the tenderness and the costovertebral angle and the flank pain. Which histologically you would see the cortex scarring and deformation of the renal calyces. I've gotten that question wrong before. And I
Okay.
guess, yeah, that's fine.
Wait, let's see. Let's see. Hold on. I think that's more like chronic kidney disease. This is more acute.
Okay,
So
that makes sense.
increased concentration with bacterial infection, renal parenchyma, most common to interstitial fibrosis, tubular atrophy, which results from inflammatory. So yeah, I mean your answer. I'm saying that your answer, right, that you picked, cortical scarring and deformation of renal calces, isn't incorrect, right? But when you're talking about scarring, you're thinking about a chronic, a little bit more chronic, right? So if they said that she's had multiple, infections, right? She's had multiple, right, as in multiple pyelonephritis symptoms, things like that, then I would lean a little bit more towards scarring. But then if you're looking for something, acute, I think B is just a slightly better answer. I don't think your answer is completely wrong, though, if that makes sense.
That does make sense.
Yeah, it's just a little bit of a acute versus chronic thing. Like I said, I don't know if on your actual test, I don't know if they'll ask you this kind of detail because this is really getting into the lower yield stuff, right? But just good to kind of always think about, is this acute or chronic? So that's what I always say.
So because she's actively having the kidney infection
Yep,
now, whereas
exactly.
someone with a history of recurrent UTIs and kidney infections coming in and they incidentally find it or something, I don't know.
Yeah, they said that if they, let's say, imagine the vignette or the case says that, oh yeah, I've had, pyelonephritis 3 times, I've had UTIs multiple times in my life that's treated with antibiotics, and she no currently not symptomatic. Maybe your creatinine is a little bit bumped, right? Instead of 1, which is usually the normal range, let's say it's 2 or 3, meaning she has chronic kidney disease, right?
Okay.
Then I would say that then that's going to look more cortical scarring deformation. So
Okay, that makes sense.